Since 5 to 10% of seniors are affected by heart failure, what can we do to reduce that risk? Well, a great place to start is to exercise 30 minutes a day. That's just walking if needs be, just something that increases our heart rate. Of course, the obvious is to stop smoking. It's also important every day to have a time to relax and de-stress. That might be spending time with loved ones, doing some breathing exercises that just slows our heart rate down and allows us to smell the roses. It's also important to keep a healthy weight. We should avoid long-term use of certain non-steroidal anti-inflammatory drugs because that increases the risk of heart failure. And then drinks like alcohol and caffeine actually stimulate the heart and are not good for heart muscle. So those are good to avoid. Having a higher resting heart rate doubles the risk of heart failure in the next 5 to 15 years in those who are middle-aged or older, both men and women. Now, when it comes to diet, heart failure has been found to be associated with a low intake of nuts and whole grains, so there's something easy we can do. Also, saturated fats, for example, high-fat dairy, like this butter and cheese, can also do it. Trans fats or hydrogenated or partially hydrogenated fats will do it. Bakery items like cookies, waffles, all of those, sticky buns, pastries, they all probably have hydrogenated fats in. And then there are cholesterol-containing foods, like eggs. That's the highest cholesterol-containing food, the highest concentration, and then we all know about salt, the high salt intake. Now, a recent study by Brown University in Rhode Island showed that women who are over 50 who eat a high-protein diet are at a much greater risk of heart failure. And the type of protein matters. For example, animal protein doubled that risk, whereas vegetable protein was protective. Now, if you already have heart failure, then here's an interesting study for you. One study showed that 120 people were asked if they stuck to a low salt diet. They've all been told about it. Only about 1 in 4 did. Yet it gave them a huge advantage because all the others were 5 times more likely to have what's called a cardiac event. And since over half of people with heart failure die within 5 years of that diagnosis, a cardiac event can be deadly. So sticking to a low-salt diet is really worth the effort. Another study found that drinking beet juice for a week, it had to be consistent for a week, made a significant improvement in heart function and exercise endurance in people with heart failure. And finally, there's the story of Franklin D. Roosevelt. He died of a stroke after uncontrollable blood pressure had left him with several bouts of heart failure. It was uncontrolled because in those days there were no medications to control blood pressure. But you know, he could have found help from Dr. Kempner's rice fruit diet. This physician was working at Duke University in North Carolina at the time and published his study. He'd been trying to treat people with uncontrolled blood pressure with just diet. He gave them no salt, no cholesterol, no saturated fat, no animal products, no low-fat, low-protein diet, and he was really surprised when he found it didn't just halt the progression of their diseases, but 2/3 of patients experienced reversal of their heart failure, reversal of their kidney failure, and reversal of their eye damage. But you know, you don't need to be that extreme that you only eat rice and fruit, as yummy as that might be for a few days. You can actually add vegetables, other whole grains, legumes, and nuts, and they will all be helpful in the management of heart failure.